I cannot hear you, Dr. Gluzman.
I can't hear you either.
How about now?
Yes.
Okay. Thanks. Total technology fail. Okay. Hi, everyone. I did such a nice speech in the beginning. I was just saying, hello, everybody. Hey, Liz. Hi, Mary. Hey, Marie. And hi, Joy. Hi, Arija. So nice to see so many familiar faces and new ones. It looks like there's a lot of people who are going to be joining us today, which is wonderful. Hi, Melissa. Hey, Mary. So I'll give everyone like a few more minutes to come in. If you're new here and you're not sure how it works, I'm Dr. Gluzman. I'm going to pin myself to the front. I'm Dr. Gluzman, as you probably know, and you have an option. You can be on video, you can just do audio, you can send a message in the chat box. I'm going to today be speaking to you about histamine, and then we'll do Q&A. And then if you're still up for it and still feeling like staying on longer, at 4 p.m. Eastern, which is in 2 hours, I'm going to be doing a talk with the equality education about parenting and empowerment. It's just a very different topic than eczema, but I think that we could all benefit from that kind of talk with someone that's very dear to me. So that will be recorded as well. It's not a Zoom call. It's like a Facebook Live. The Zoom calls are only for members, and that's on the Eczema Rescue Club, our sister community that has over 5,000 people now. So that's the one that I'll be going on live at 4 p.m. Eastern. So let's just give everyone a few more minutes. Today is full of information. And if you want to take some notes, you can. Of course, this will be recorded, and I'll be posting this video and all recorded videos that we have together for anyone that misses it, or if you have to go, you can always rewatch and re-listen later. I just have my team like edit things, so it takes a few days or so to get it up inside the digital program and inside the community page. So give me 1 sec. I will just adjust some settings. And we'll get started, let's say, in about like 3 minutes. Thanks. Okay, here we go. All right, everyone. Should we get started? Just want to make sure there's no one in the waiting room. No, okay. Hi, okay, no one in the waiting room, great. Right, so if you're new here, I see some new faces. Welcome, big welcome. Hey, Jen. Okay, if you're new here, hey, Joy. If you're new here and you would like a little intro on how things work, just let me know at the end, because today I really want to spend the time to talk about histamine. So today we're going to be speaking about what histamine intolerance is and how it's related to eczema. Whether or not your child should embark on a low histamine diet, that big question, right? And some holistic solutions for histamine overload. So there is a whole entire segment that you could refer to. So when I speak about whole lists of food about that have histamine or are very histamine rich, I'm going to refer to you to the whole lists, and all the information is actually written down for you inside the digital companion. That's like our textbook. So I can see that like who logs in and who doesn't, and which chapters you're doing, and I monitor that all the time. And I really encourage you to use that as a resource. The digital program is the one that has that login. If you don't remember, you can always just reset your password, or if you're like completely lost, send me a message. If you can't find what you're looking for, you can send me a message and I'll help you troubleshoot it. You could look at it on your desktop. There's also an app that you can download to view the courses in like really great sections on your smartphone. So check out that digital companion. There's also downloads that a lot of people don't see, but that's where I put all the lists that are easy to print and easy to use. So check that section out, and there's something there for everyone. So if you're a learner that likes to watch videos or just like listen to videos, maybe while you're driving or cooking or just walking your dog, you can do that. There's a lot to read. You don't have to read anything if you don't want to. And then all the lists are there as well. And again, check out the downloads. So question, so let's talk about histamine, which is, I think, as a practitioner, I'm a pediatrician in the realm of conventional medicine. And I have to say that one of the most frustrating things about conventional medicine, and also in the realm of holistic medicine, functional medicine, I have a holistic and functional pediatric practice in New York and New Jersey. It's Blossom Pediatrics. One of the most frustrating things is the amount of kids that have a massive problem and the lack of solutions. You've heard me so much speak about the difference between addressing just symptoms versus addressing the root cause of the problem. And this is where I see it the worst, because how many of your kids have histamine overload? And if you're not sure, that's completely okay. That's why you're here. And I hope that some of the information here today is going to help you figure it out and how to proceed, okay? But how many of your kids, you might not know if they have histamine overload, but how many of your kids have things like seasonal allergies, like things like hay fever, things like allergic rhinitis? Allergic rhinitis is when your child or you is exposed to something and then you have that really watery nose. It runs and runs and runs. And in kids, that looks like they're always doing this with their hand. And there's an actual sign called a salute sign that where you basically have kids that do this so often because their nose is always itchy and runny that they develop a little line across their nose. Think about it. Is that your kid? How many of your kids have something called allergic conjunctivitis? That's when there's an exposure and eyes are itchy, they're runny, they're watery, and all kind of comes together in allergy season. How many of your kids have wheezing or asthma or just coughing all the time during certain seasons, okay? Did you know that the same problem that causes these seasonal allergies, allergic rhinitis, allergic conjunctivitis, all of these symptoms, the wheezing, the asthma, can also trigger eczema? And the confusion is that not all kids with eczema have eczema because they have histamine overload. And this is where I'm going to try to help you figure out how to approach this problem and see if that's indeed the problem or not. So, how many of you, by the way, have seasonal allergies? You don't have to answer, maybe you could write in the chat box, but it's actually not a normal thing. So I've been in medicine for 15 years now. And I recall 15 years ago, there was really no big push on educating, like when I was in medical school and doing my residency, no one spoke about seasonal allergies, allergy medications. It wasn't like a thing to talk about. It was kind of rare. It wasn't common, okay? When I give you the numbers of kids and adults who have these histamine-related issues, it's mind-boggling. But the only solutions that we have are the ones that simply cover up symptoms. So, how many of you have seasonal allergies? How many of you have hay fever, right? That's another name for it. How many of your friends, your family members, your colleagues, the people in your life, the people that you interact with daily have seasonal allergies or hay fever or all of these allergic issues? Most likely there is really no shortage out there. And from the CDC, the numbers are staggering. So for people who are over age 18, and all of your kids are going to be 18 soon, sooner or later, maybe not so soon, hopefully, but like they have time, they will turn 18. And what we're trying to do here is make sure that the eczema and all the other related symptoms and the allergies go away soon, and that you're doing the steps that you need to take to make sure that they resolve, okay? Because for people who are over 18, the percentage of people who are diagnosed with hay fever in the past 12 months only is about 8%. Now let's talk about kids, because we're here for our kids. For kids who are under 18 years old, in the past 12 months in the US, the percentage of kids who have hay fever is about 7%. The percentage of kids who have respiratory allergies, so that's like asthma, reactive airway disease, or just wheezing all the time in certain triggers or exposures or seasons, could be any season, is about 10%. That means 1 in 10 kids during a certain time of the year will have wheezing, coughing, respiratory distress, asthma exacerbations, reactive airway, will need albuterol to open up their airway, will need steroids to make sure that they don't go into respiratory failure, which is very dangerous. The percentage of kids in the US who have food allergies in the past 12 months, so not like a lifetime, but only in the past 12 months, is 7%, according to the CDC. And the percentage of kids with skin allergies, including eczema, or another word for that is atopic dermatitis, in the past 12 months, ready for this? 12.6%. Those numbers were like 1-2% about 15 years ago. So we more than quadruple the amount of kids who have all of these issues. This is a problem. What do all these medications have in common? Okay, the Astelin nasal spray, the Allertec, Zyrtec, right? Any of the Zyrtecs, Clarinex, Benadryl, things like NyQuil, Allegra, Atarax, Patanol eye drops, Zyzal, Patanase eye drops, all Allerclear is another one. All of these medications, if you don't know, they not only just treat symptoms, but they are antihistamines. And there are different kinds of antihistamines. So all of these antihistamines, chances are your child might have been on one of these antihistamines, and that's quite all right. They work really well. These antihistamines work really well to stop the symptoms of histamine overload in the short term. They work for a certain amount of time and then they stop working and the problem comes back. They do not heal anything. They do not treat anything. They prevent worsening symptoms. They prevent symptoms. They make sure that your child or yourself is comfortable. So what is histamine, and why do we as a society have so much histamine overload according to those numbers? Like, the question is like, where did this come from? And what does that link to eczema? Histamine is not a bad thing at all, by the way. Histamine is a chemical messenger. It's found naturally in our bodies and everybody's bodies in a cell called the mast cell. The mast cell is like a major defender in an attack, okay? So when you have things like different kinds of foods and chemicals and pollens, when you have things like other substances that are causing this massive potential of this potent histamine chemical, you might get a histamine overload. So let's go to science just for a few minutes, because I think it's very interesting and I think it will help you understand what's going on. When our bodies in general, like in a normal response, a healthy body of your child or an adult, when a body encounters a new foreign substance, it discerns whether or not it's a friend or a foe. So in cases like eczema, asthma, hay fever, even like food allergies, even ADHD, where inflammation drives the disease, the immune system overreacts to an otherwise normal, benign substance. The antibody immune system response really depends on the perceived level of threat. So the most dangerous intruders into a body elicit the production of IgE, which create the most kind of like a most wanted poster for this invader. So when a mast cell, this major defender cell that should be there and should be mounting a very appropriate immune response, when the mast cell encounters an IgE activator, something that shouldn't be in the system that activated IgE, in our bloodstream or in the tissue of the body, they can unleash an entire load of what's inside to protect the body, which is histamine, which sets off a chain reaction of events. And this is where you see the symptoms. So the most severe form of this reaction is anaphylaxis, or like a severe allergic reaction where the mouth swells, the throat swells, the eyes swell, the child can't breathe, and you need to have things like EpiPens, epinephrine injected to make sure that it's not a life-threatening response. I'll get out of the science a little bit. We will focus our discussion right now on histamines in the skin. So when a child already has an overload of histamines and then eats a food or encounters like a substance from the environment, for example, that elicits even more mast cells to release, the histamine reaction is often manifest on the skin as eczema or itching. These capillaries, which are blood vessels right under the skin, they leak and allow white blood cells or other defenders into the skin, which causes the itching, the redness, the swelling, and the ulcerations that we're also very familiar with. So histamines are just one branch of the inflammatory tree. There's a whole entire immune system that typically plays a role in the eczema skin condition. Histamine is just like the trigger of activating a very, very significant response. So the next question becomes, why are kids developing these antibodies against harmless substances? This is the big question that no one in conventional medicine is asking, and it's driving me crazy, and it should drive you crazy too. Why are things like peanuts and pollens and springtime and different foods triggering all of these mast cells to release uncontrollably and cause all of these massive reactions? Again, 13% of our kids have allergic skin reactions, eczema on the skin. It's poorly understood, but most likely it's from an overactive immune system, a leaky gut, and possibly even our historical treatments like in the past. So a number of factors can influence our baseline amount of histamine, including diet, stress, environment, just life in general, nutritional deficiencies, drugs, hormones. All of that can influence how much histamine your child, on a baseline level, typically, how much histamine your child has in the system. Even though pollen may be like a substance that takes the body into full allergic reaction, or a food that your child eats that they're allergic to can bring your child into this very robust allergic reaction, the body already has been primed with high levels of histamine from all of these other factors, which is why seasonal allergies get better with the changes of things like diet, stress, nutrition, hormone regulation for older kids and adults. Generally speaking, histamines are cleaned up by an enzyme called diamine oxidase. We'll call it DAO, which is DAO for short. This is really important. DAO takes the histamine in a body normally, naturally, and basically cleans it all up and gets rid of it, so the response is no longer there. So your child is not constantly responding. That was produced in certain places in the body. That was produced in the kidneys. It's produced mostly in the kidneys, mostly in the gut lining, a little bit in the thymus, which is an organ that only very young babies have. Certain populations of kids have genetic predispositions to having low levels of DAO, but that's a very small percentage, especially when you look at how many kids in the past had histamine overload issues and how many kids today now have. So we can't blame genetics. And if you heard me speak earlier about like all the myths related to eczema, to all of these atopic illnesses like asthma and allergies, it is not just genetic, and there's so much you can do to influence it. Stay with me, because we will talk about exactly what you can do. So the gut plays the most integral role in the development and persistence of eczema. I'm going to say it again. It's the gut that we need to focus on for our kids with eczema. It's like step one, most important step. You can't skip this step. It is the most important thing to do for a number of reasons. The main reason is because leaky gut, when your child's gut lining is leaky and allowing things into the system that shouldn't be there because it has leaks, because the integrity of the gut lining is not strong. When it's leaky, it allows large immune activating molecules into the bloodstream, and a very normal immune response is elicited, and histamine sees these as foreign objects and releases histamine. So a sick gut then does not produce, in addition, gut lining that is not healthy, that doesn't have the right integrity. The gut lining is leaky, the microbiome is not diverse or healthy, the microbiota, which is like the bacteria plus the viruses and fungus that are everything that lives in the gut, all of the bugs and all of everything, the fungus, the bacteria, the viruses, even the parasites. When that's not healthy, DAO can't be DAO can't be created properly. And so the histamine that is in your child's system is not being sopped up and cleaned up, and you have all of these symptoms. So as I just said, histamine is only one part of the eczema equation, but in my opinion, it's really not the place to start from a treatment perspective. Just let this person in. Traditional medicine has really only aimed at tackling the problem from a symptom approach, and it's not wrong. We do need to make sure that our kids have symptom relief, that they're not scratching and itching and have runny eyes and runny nose, and they're able to function and learn and sleep. It's not wrong. But if you're relying on symptom management and all of those antihistamine medications that I just pointed out to you, you are going to end up in the same place, if not worse, because you're not treating the root cause. So the first, let's talk about, I'm gonna not overload you with a lot of science. Let's talk about the first question. Does my child have histamine overload? Now, some of you already know your child has histamine overload. You figured it out. Most likely it wasn't your pediatrician or allergist that told you about it, but you know that when your child eats certain foods that are high in histamine or certain seasons come, your child has histamine overload. So if you already know, stay tuned. I'm going to tell you how to fix it. If you're not sure, which is where most of you lie, if you're not sure if your child has histamine overload, there are some things to consider if you're going to pursue basically fixing the problem and also diagnosing it by yourself. So some of the hints that your child might have a histamine overload is that they have seasonal allergies or hay fever or allergic rhinitis, allergic conjunctivitis, and they have symptoms when they eat histamine-rich foods or histamine liberators. Now, not all people who have histamine overload or histamine intolerance have eczema, okay? This is really important. Having eczema does not mean that there's a histamine problem. Having a histamine problem does not mean you have eczema. For adult populations, for older kids and adults, the symptoms of histamine overload can be eczema, but it could also be very non-specific symptoms. And this is a problem because non-specific symptoms in medicine means that lots of different things can cause these symptoms. One of those things is histamine overload or histamine intolerance. So some of these non-specific symptoms are things like, and there's a list on the online program, are bloating and diarrhea, like just general upset stomachs. So for little kids, they might always be complaining of belly pain, or their belly might get really big and distended after eating certain foods. It could be headaches, flushing of the skin. How many of you have seen your child's cheeks turn really red after eating a certain food, or maybe on the chest? It happens to me all the time, by the way. Flushing on the skin, flushing on the cheeks, most likely. Things like rash, hives, of course, is a histamine issue. Eczema also can be a histamine issue. In older kids and adults, and especially older adults, it could be things like arrhythmia or irregular heartbeat. Low blood pressure, which is usually only seen when things are really bad and that needs emergency treatment. Things like wheezing or asthma, runny nose, watery eyes, swelling of the hands, face, or lips. Swelling, by the way, is an emergency. Always seek emergency treatment when you see any of these symptoms. Things like heartburn, very non-specific, could also be a histamine overload issue. Itchy skin, in general, without eczema, could be a histamine issue. And for women, it could be PMS, which most likely looks like headaches around the menstrual cycle, or maybe very painful cramps, most likely. That could also be a histamine overload issue. So why is the problem of histamine why is histamine on the rise in general, right? We talked about it being leaky gut. We talked about It could be microbiome is disturbed. So, and the gut health is in general very disturbed. So we have DAO not being produced enough. There are also other factors. I don't want to blow them off. They are real. We have a lot of climate change that causes an increase in how much pollen is circulating in our environment. We have, yeah, that's like a big one, and air quality issues in general. So when I teach the eczema rescue program that you're all in, and thank you for being here, I don't start off with stop histamine from day one. And the reason, and of course that would be great because it would be easy, right? We can stop all the foods that might potentially have a lot of histamine, plus things like dairy and sugar and gluten and everything that your child shouldn't be eating. Plus they might like already have a lot of allergies that are non-histamine related. And it would be really easy if I said to you, well, my patients at Blossom Pediatrics that I work with one-on-one, I can't say, you know what, just stop all the histamine-rich foods. And let's see what happens, right? It could be diagnostic, it could also eliminate symptoms, but that's a really big problem for kids who are growing because they're already so restricted. How many of you already have kids who can't have this and that, plus you're eliminating dairy, sugar, gluten, maybe, possibly, if you're doing this program. Here's a list of foods, and you could always reference the digital program for the full list. There are foods that are very rich in histamine, so they're not bad foods. They might be very good for your child. They're especially fermented foods, and that's the problem, that ferments are the most potent probiotics, and they're very helpful in healing the gut, but they also have really one of the most massive amounts of histamine. Things like vinegars, by the way, are ferments. Things like pickles or pickled vegetables, anything pickled, anything fermented, meats like sausages, salamis, fermented ham that are cured or fermented, those have histamine, lots of them. Tomatoes, eggplant, spinach, frozen, salted, or canned fish like sardines or tuna have a lot of histamine. Apple cider vinegar, any vinegar has a lot of histamine. Anything tomato related, like our kids love ketchup, have a lot of histamine. Citrus as well. What did I forget? Sourdough bread is fermented, a lot of histamine. Soy products like tempeh, miso, soy sauce, natto have a lot of histamine because they're fermented. There's another section of food that don't have a lot of histamine, but they help the body release histamine, okay? Those are the very popular: bananas, chocolate, nuts, cow's milk, papaya, and pineapple. They have a lot of histamine. So if your child has any of the symptoms of histamine overload that I mentioned, or their eczema gets a lot worse when they have any of these foods, or if they're on tons of antihistamine medications that I mentioned earlier, or if they have really bad seasonal allergies, any season, or allergies could be the runny nose, sneezing, runny eyes, itchy eyes, eczema gets worse in the springtime, those could all be symptoms of histamine intolerance. So what can you do about it? I always suggest going through the program first, and then if you're not seeing, like by week 4, any improvement, first step is cut out the foods that are histamine rich and histamine releasing, okay? Second thing you do, that's the root cause medicine aspect of it, is literally heal and seal the gut lining, which is what we do when we incorporate a lot of stocks and broths into the system and restore the microbiome. Give your child the building blocks to heal those rapidly dividing cells of the gut lining so it's no longer leaky. And then you could also have a child who develops appropriate amounts of DAO enzyme that remember, it takes all that histamine away. So when you're healing the gut, and that takes time, you want to do it in a very specific way. This is the most root cause thing you can do. So when I'm asked as a pediatrician and I'm going on like a major like allergy tour now in with my practice, basically doing podcast episodes and talks in New York and New Jersey and teaching in medical schools. And the question is like, can you reverse allergies? Can you heal allergies? And I'm not talking about food allergies, but I am talking about things like seasonal allergies. Yes, absolutely. And the way to do that is to heal and seal the gut lining, restore the microbiome, but you cannot use certain parts of this program to do it. What you cannot use is any of the ferments. So you have to choose instead to restore the microbiome by switching to very specific kinds of probiotics. Okay, switch to histamine safe probiotics. I'm going to link, and also inside the digital program there's a list. It's linked to my FullScript account, so you have a really big discount if you want to get the probiotics through FullScript, which is my dispensary. But they're basically 3 that I love to, actually 2 now that I love to use. Smidge sensitive is excellent. It's expensive, but a little goes a long way. It is excellent. I'm seeing the best results with it. Or Probiota Histamine X by Seeking Health is another great one. So that's how you're going to restore the microbiome. Get on a really, really high quality probiotic and use it very consistently. Don't use ferments if you're suspecting histamine overload. What else can you do to make sure that there's enough DAO enzyme to go around? Use this DAO supplement. So the DAO supplement that I've been recommending that has been helping a lot is basically just kidney, which, by the way, you can cook, but it doesn't taste great. So I can't even say I could really recommend it because it's a very specific kind of taste. Bovine kidney has so much DAO enzyme that if you eat it right before, like 10-15 minutes before your child eats, or just eat it frequently, or have your child eat it frequently. And I'll have a recipe posted for you inside the digital program shortly. If your child eats it, then they're not going to have such a massive histamine response to foods in general. Or you could take a bovine kidney supplement for your child, the age of which I would say is like no younger than 3 years old. Of course, always speak to your child's doctors before initiating any supplements. Because I'm not your child's pediatrician, you should always ask them before initiating any like protocol or massive dietary change. It's just really good practice to let them know what's going on. Most likely they haven't heard of DAO enzymes, but it's really just kidney dried up, bovine kidney dried up, and then powdered into a capsule. For kids who don't swallow capsules, you could open up that capsule and sprinkle it onto something. So the brand that I recommend for massive potent DAO is by Seeking Health, and it's called Seeking Health Histamine Digest. They have a lot of different kinds of supplements. Seeking Health Histamine, they have like other types. This one is Histamine Digest. Don't get things like histamine block. Don't do that. Now, how do we heal and seal the gut lining? You have to know that bone broths are different than stocks, and both are very, very helpful in healing and sealing the gut lining. Let me just refresh your memory. In week 3, we heal and seal the gut lining by using healthy fats like ghee or coconut oil, olive oil, tallow, and stocks and broths. Okay. The difference between stocks and bone broths is that stocks have a very short cooking time. They are generally simmered for like 20 minutes up to 4 hours, depending on what you're making. Don't use pressure cookers with a lot of pressure to make it faster. Stocks always include meat and meaty bones. And they're great because they're convenient. So it's like very short cook. They taste a lot better. They have a lot less histamine than bone broths. So if you're suspecting histamine intolerance, you're going to only use stocks. Bone broths have a lot more histamine. Bone broths are also made mostly with bones, but you could also use meats, but they're cooked for a lot longer, like at least 4 hours, up to even 48 hours. They're that slow simmer that takes forever. It's wonderful because it does have a lot of amino acids. It has gelatin, it has minerals and healing fats. So do stocks. They're different. You can definitely heal and seal the gut lining just by using stocks. Just make sure that you're not using pressure cookers to speed up the process. You can use pressure cookers on a slow cook setting, that's fine, but you want to do it slowly. Another way to minimize histamine with stocks is to not store it in the fridge for a long time. Try to make things fresh. The longer you have something sitting out or like in the fridge even, the more histamine develops in that stock. So again, for kids who are histamine sensitive, who are histamine overloaded, or maybe you're just trying out for about a month to cut all the histamine out, use stocks to heal and seal the gut lining. There are other things you can do that I really encourage you to do if you're battling this issue, if you're battling wheezing, asthma, if your child has a reactive airway, if they're coughing a lot during springtime, if they're having springtime allergy symptoms. I really think that at this point in life in the US, wherever you are, it's worth getting an air purifier. The one that is in your child's bedroom, the one that I use and love is the Air Doctor. It's so much benefit it's like a lot of bang for your buck. It's not cheap, but really any HEPA filter will do because it's going to minimize the constant underlying release of histamine that goes in through breathing lots of air pollution that will stimulate a histamine response. And finally, you definitely need to follow the instructions of your doctors, but there are other tools, other supplements that you can use to decrease the symptoms. So one supplement is called D-His Jr. It's a quercetin supplement. It's a blend of not just quercetin, but flavonoids, antioxidants, proteolytic enzymes that break everything down, botanicals, and it's designed to be a very comprehensive support for children with seasonal allergies caused by environmental triggers. Quercetin is that star ingredient. It is a very powerful flavonoid. It supports a healthy histamine level. It's not going to work right away like antihistamines. It's not going to release symptoms right away. I would say during like if there is a big reaction or if you're trying to kind of really heal a histamine issue, heal the gut so that the histamine is no longer an issue, use something like D-His Jr. or I mean, that's the one that I really like for younger kids who are about 2 to 5 years old. I would say there's another supplement that I really like called, it's just blanked. My mind just blanked. Creekside Naturals. It's a quercetin with and N-acetylcysteine. That's good for kids who are over 2 to 5 years old. Sorry, 1 second. It's called Snifflex. Sorry. I worked all night in the hospital and I'm like, where's my brain today? I don't know. So quercetin is a star ingredient in both. Bromelain is another star ingredient in both. It helps the absorption of quercetin, so that makes sense. It supports mucosal tissue, like the tissue in the nose and the mouth and the lungs, all the mucosa in the gut lining. Stinging nettles, you could actually buy stinging nettle leaf tea. Someone asked recently which is my favorite brand. I really like Star West Botanicals. I like loose tea. And you could have your child drink that all the time. Stinging nettles help balance hyperimmune response. So your child is not responding to everything too much. It's an herb, it's natural, it's holistic, it's safe. And N-acetylcysteine clears the airways by promoting normal mucosa. So your child's nose is not constantly running. Now, again, this is not something that you're going to take and then you're going to see massive improvement like you do with any of the antihistamines, Clarinex, Zyrtec, Allegra, Benadryl. Those are immediate relief. These herbs, flavonoids, botanical supplements need to be used for like about a month every day to see good response. Another supplement that I think is lovely to take and is homeopathic is called Genexa Allergy Care, where they blend, don't confuse that with the Genexa Allergy, which is actually a clean alternative to Benadryl. Make sure you get Genexa Allergy Care. Genexa is a brand that makes really clean medicine, and their Allergy Care homeopathic formulation has like 12 different homeopathic remedies that help ease the symptoms and balance the histamine response in your child's body. So if you're just starting, I'm just going to recap. If you're just starting the eczema rescue program and you're like, don't really suspect histamine to be an issue, I don't recommend cutting all the histamine-rich foods out of your child's system immediately, because your child needs to eat, and it's not about cutting things out. If you're been doing this and you did 4 weeks really intensely with good well, and you've done the stocks and broths every day, and you've done the ferments, and you've taken out all the things that might not be serving your child, and you're using a lot of really whole foods in your child's diet and maybe juicing and smoothies, and you've really done 4 weeks of that, and you're still having a child who is having no improvement at all, I suggest going to the module that talks about histamine overload. It's called My Child Is Not Better, Now What? Histamine. And then consider doing another month with a histamine reduction. Finally, one last thought about histamine is that it's additive. So there's kind of like, if your child runs out of DAO enzyme, it's going to send your child into symptoms. As long as there's enough DAO enzyme, then there are no symptoms. So it's additive. So the more kinds of histamine-rich foods that your child eats, plus exposures that your child has, the more symptoms will develop. So it's not like, one banana will do it for a lot of kids. It might be a banana plus ferments plus bone broth, and there you have it. So thank you I just rattled off for a very long time. I hope this was helpful and clear. And I'm going to take your questions. So if you want to raise your hand, I'll call out, or just maybe unmute yourself. And I'll actually start with let's see, there's a lot of questions here. Hold on one second. Okay. Or Vijay, you had a question.
Right. Yeah. So, doctor, I think, so I'll be honest, for my daughter, I haven't done week 3 and week 4 completely. Like juicing, we have just started. We have never done ferments or stock and broth. But what we noticed 2-3 episodes where her eczema patches and various other things came out like so suddenly on her skin. Like this Saturday, she had a pineapple, and she went for nap, and by the time she was up from the nap, her most of the part of her skin was very itching, and her eczema patches were so red than ever. Otherwise, her skin was doing fantastic, and then suddenly with this one episode, it became like that. So I'm suspecting she has a histamine overload.
Mhm.
Although I have not done week 3 and 4, I'm going towards following the whatever we talked. Is that a right approach, or should I still do week 3 and week 4?
Okay. So that could also be so if there is a reaction to a food, it could be a food allergy or a food sensitivity, mind you. It's not necessarily histamine. What you can do is, of course, don't give her that food that caused the reaction, but it might not necessarily be histamine reaction. It could be an allergy, right? So there is a way to test I forgot to mention, and I'd like to mention it now with this, but there's a way to test histamine. In the realm of conventional medicine, it's a very, like, if you go to your regular allergist, the testing is not really helpful, especially for just regular old histamine overload, but there is a test, and it's part of the Tiny Health test. They run histamine on that. And that's why I'm actually saying to people now more than ever that if you're suspecting it, you can just do this like approach where you cut everything out, or you can be guided a little bit more by doing the Tiny Health stool test. And that will tell you whether or not your child has a lot of histamine circulating in the gut and in the body. So if it's very, very high, of course, do this histamine reduction approach and make sure that you work on the root cause, which is healing and sealing the gut lining and restoring a healthy microbiome, so that your child is not constantly overwhelmed with an influx of exposures that trigger mast cells to release histamine, and at the same time your child is able to create enough DAO enzyme to clean up all the histamine that is normally and naturally released in a body that is healthy. Get it?
So along with, so yeah, I think Tiny Health, we are planning to order it. And along with that, we also have an allergist appointment.
Yeah.
Should we make sure about any specific allergy test uh,
Yeah.
to uh-huh,
Yeah, I
for
mean,
the
keep a diary, like if you notice flushing,
mm-hmm,
redness, itching, eczema getting worse after your
mm-hmm.
child eats a certain food. If you notice that, then keep a diary, write it down, and ask your allergist about it, who might want to do the testing. So they might do a
Okay.
skin test, they might do a blood test, they might, if you're looking for like sensitivity testing, it's a little different. That's in the realm of of functional medicine, but at least you have a good place to start. Not all allergies are the same. Sensitivities and allergies are different. There are different types of allergies. So your allergist will help determine which testing would be most appropriate, but they're not going to say much about histamine. Histamine response is not an allergy.
Okay. Okay. Mm-hmm, mm-hmm. But for now, till the time we figure this out, I should still go ahead with considering that she has a histamine and whatever you suggested, stock, no bone broth, right?
Yeah, yes,
And
you can. Yeah. Mhm.
and we are vegetarians. So I have to do the vegetarian stocks. That is okay, right?
Yes, that is
I
okay.
mean,
It's the meat stocks that create a lot of histamine when they sit out for a long time. Yeah.
okay,
There's a
okay.
really good recipe inside week 3, by the way.
Yeah.
Mhm.
I came across that. Right. I'll be doing that one. And that I have to give like how much every day stock?
So it really depends on the age. The
She's
point is
three
not
and a half. Three and
Three
a
and a half.
half. Yeah.
Okay. So in general, it's not about how much, it's about frequency, and it's about
Mhm.
doing it the best way possible, which is giving stocks, or if you're giving your child bone broths on an empty stomach between meals, having them sip it warm every day, multiple times a day. There is no maximum, but there is a minimum.
Mhm.
And that minimum is not really a quantity, but it's more like minimum frequency. Every day, you have to give it to your child every day, all the time. You could also consider, so how much for a 3-year-old? I would say about a cup a day minimum.
Okay.
Yeah.
Okay. Okay. And say probiotics. I think when I'll purchase it, they will have instruction like how much to give.
Yeah,
The
it's on the bottle based on the
uh,
size. So like
and,
go with Smidge is really great for kids, Smidge
and
sensitive.
and for how long should I give? 1 month? I think you did mention that before. 1 month is a
Um,
good time.
a month or 2 is good. You don't want to
Uh,
sit, in general, I don't recommend using probiotics, like the same one, for more than a few months, because what we're
okay.
looking for is it really does take like a month or 2 for everything to populate through probiotics. And then you want diversity. You don't want just this one thing in your child's system. So
Mm-hmm.
these probiotics are not meant to be used forever. And I say doing testing like Tiny Health will really help pick the right kinds of probiotics for you. I'm actually
Okay.
gonna post inside the chat box right now, the link for the supplements and also for Tiny Health, okay? For
Okay.
the,
And that's also there in the presentation you have in the program, right?
yeah,
The probiotics and the homeopathic medicine you mentioned. If you can write it down in
it's all
chat.
on that link. I just posted it. So
Okay.
the Genexa, His Junior, Smidge, and Seeking Health Histamine Digest, like if they're all in that link. And you could get
Okay.
these supplements anywhere, but Full Script gives my members a discount. So I think that's a good deal. Plus they have everything super fresh.
Okay. I do have a other question, but I'll let other people go and then I'll
Okay,
ask you. Yeah.
thank you.
Mm-hmm.
Let's see. Oh wow, and there's a lot of questions. Okay, let me just quickly, or not quickly, get to the chat box. Let's see. I'm just gonna ask a few questions and then I'll get to the folks with the raised hands. Marissa said, I'm not sure, but noticed my kids had reactions to probiotics such as constipation and gas. Then I tried Smidge sensitive and they didn't react. So I'm assuming they're histamine sensitive. Not necessarily, Marissa. Probiotics that are very potent as well as ferments can cause gastrointestinal upset when they're very effective. So it doesn't mean that it's a histamine issue. I'm glad you asked that. So when you introduce beneficial or the good bacteria into a gut that has a lot of bad bacteria, the bad bacteria start to die. And if that happens too quickly, you can have digestive symptoms like diarrhea, upset stomach, bloating, gas, burping. So that could have been the case because smidge is very potent, not necessarily histamine issue. Let's see. Kat said we started in smidge a week ago and that plus clean diet seemed to be helping. I'm really happy to hear that. That's great news. Marissa asked, how old do kids have to be to take the DAO enzyme? There's really no like very specific, it's really just bovine. It's not, I can't even call it a supplement. It's really just vitamin C, a small amount. The enzyme, the Seeking Health Histamine Digest is the enzyme DAO, which is just bovine kidney. It's ground up, and in that amount of bovine kidney, which can be given to kids of any age, really, bovine kidney, it's an organ meat. So you basically have meat that's dried up and ground up, and then they add a little bit of vitamin C, a very small amount, and that's the supplement. So I would say that over 3 would be very appropriate. You can, for a child who's about like 3 years old to maybe 5 years old, you don't have to give a whole capsule, maybe like just sprinkle on a little bit and then look for of that capsule and maybe like spread it out throughout the day. Okay. Let's see. Maggie said, I feel like I'm going to have a hard time determining if my son is histamine sensitive. I just Googled histamine sensitivity and it brought up histamine sensitivity tests. Do you recommend taking a histamine sensitivity test that they sell online? No, I don't. There are a lot of tests that they sell online that I think are just don't have a lot of data behind it. Practice evidence-based medicine for me to recommend something, and I'm very picky with my recommendations. I have to be very impressed, and it has to have a lot of data. There are a lot of things out there that are just not helpful. They don't have good science behind them, and so I don't. But if you do want to test, that the only test that I recommend to check is Tiny Health test, and here's a coupon if you want to use it. Use this link. And yeah, I have a link here. Hold on. Where's my link? I'll post a link inside the group in a second, and then there's a code, and then you get $20 off. So, yeah. Okay. Let's see. Kat said, which was the supplement for kidney we should use? I want to make sure I get the right thing in your full script. If you use the histamine 30-day challenge link, it's the Seeking Health Histamine Digest. That's the one that you need to be getting to help. Okay. Let's see. Liz, did you have a question or a comment, or do you want to unmute yourself?
Yes. Hi. So I do suspect that she does have a histamine overload. We previously last year, whenever I would give her like histamine releasing foods, she would have a flare for maybe a couple of hours, and then it will go away. So I was really, I was like, oh, okay. So I just need to make sure that they're not there. My question is, now that it's here in Arizona, it's okay, baby. She wants to see. Now here in Arizona, it's going to start springtime, and it's super windy, and we've all had allergies. I myself am on like prescription grade Flonase and Mentolita, like I've always suffered from allergies. My question is seasonal allergies from trees, like we have the palo verde outside, like in our house, which I'm allergic to, would that affect then her or make the histamine overload more, and then she will have flares in the spring?
Yes.
Does that make sense?
Yeah. So spring is like one season, but allergies, because there's a lot of pollen and it's a common trigger for a lot of families. So when you have, because there's a lot of, let's say, springtime and there's some kind of tree blooming, that exposure is very constant, and that's why I recommend air purifiers in bedrooms. There are other things you could do for springtime allergies, like making sure your windows are closed, when there's a lot of exposure, you could check the Weather Channel because they have pollen counts. Like some days are worse than others. You keep the windows closed, use an air purifier. Don't walk in the house with your shoes on. If the allergy is something like dust mites, you want to minimize the exposure by getting air purifier, taking all the carpets and rugs out of bedrooms, making sure that the mattress and like pillows are covered with dust mite protecting covers. So these exposures are kind of like constant and always there because they're air outside or dust mites in bed. And so that creates a underlying constant higher level of histamine response in the body. So when your child already has it pretty high and then they eat something that has a lot of histamine, they could have a bigger response because there's not enough of the DAO enzyme to eat it, to take it all up, to clean it up.
Oh, okay. And
Yeah.
my second question to follow up with that would be like, is the kidney capsules the same as maybe the liver, or
No.
are they two separate? No, they're
Yeah. So kidney. So in a perfect world, I would say cook the kidney, but it's gross, in my opinion. Like I cannot eat it. I tried. It's just tastes very interesting. And there's a recipe that is like pretty okay, but that's in a perfect world. If you could figure out how to make it delicious, please let me know. Please let us all know. That would be wonderful. DAO enzyme is in kidneys, whether they be, kidneys from anyone, any animal. So so the supplement is the kidney. Liver is different. Okay, liver doesn't have DAO.
okay. Thank you.
You're welcome. Has a little DAO, not a lot, not enough to make it worth taking a supplement. And I'm not huge on recommending supplements, by the way. Like, really, this is not the solution, everyone. The solution is not to give a supplement. The solution is to give a supplement as a bridge while you are working on repairing the gut lining to heal the leaky gut. So this problem is not there anymore in like a few months or a year. The solution is healing the gut lining so your child's body can make enough DAO itself so you don't have to supplement in the future. Okay. Yeah. Great. Let's see. Sujana, hi, do you have a question? I don't know if
Yeah,
it's
hi, doctor.
did I say your name correctly? I'm sorry.
Yeah, it's correct. So my question is related to a newborn baby eczema.
Mhm.
And my baby is a 4 months old baby. He had infection on his cheeks. So pediatrician treated him with muprosin and steroid cream for a week, but he was still oozing. Then we saw a dermatologist. He prescribed him antibiotics, a stronger one, compounded with zinc oxide. So his oozing stopped, but he's very itchy from last 3 days. I'm holding his hands at night and he's still scratching. Although I cut his nails and he's wearing silk mittens all the time. But there's a cycle that's coming up. So how we can break that cycle of like him weeping, and then we apply antibiotics that stops oozing, and then he still scratches after a couple of days, and then the oozing repeats again. So how we can stop this cycle?
Yeah. First of all, I'm so sorry. I know it's already tough with sleep and with a 4-month-old, but a 4-month-old that is constantly sick and not doing well, it's extra tough. So my heart goes out to you. First of all, know that you can stop the cycle and you will stop the cycle. The best way to stop this cycle is, yes, you do have to use conventional medications, antibiotics, sometimes steroids. You have to use them when you have to use them, because the risk of not using them can be really, really dangerous. So it is not wrong at all to use antibiotics, the bacitracin, the antibiotic cream that you were using, the steroids you were using. Your pediatrician or whichever doctor prescribed it was concerned that it was going to spread. I work in a hospital setting, as my background is hospitals medicine, so I know what goes wrong when when things like impetigo and skin
Mhm.
infections don't get treated, what could go wrong is that it could spread to the bloodstream and cause sepsis. This is like what I see all the time. It's so you
Mhm.
have to, there's nothing wrong with using these medicines, but you're in a cycle. And so yes, use these medicines, right? Of course,
Mhm.
always. Oozing is a massive sign that there's an infection. Most of the time it's bacterial, but it could be fungal, it could be any infection that's oozing.
Mhm.
Another way to approach it to stop the cycle, which is like the main point of why we're here, right? Is what do we do to stop the cycle? Is to skin will, first of all, you have to make sure the integrity of the skin is healthy. So
Mhm.
everyone has bacteria and fungus and microbes and viruses on their skin.
Mhm.
Everyone has staph on their skin.
Mhm.
Everyone, it's normal, right? But why do some kids get infection and oozing and abscesses and right? Because the bacteria gets under the skin, and that's because the skin is broken in a child with
Mhm.
eczema. So first you need to make sure that skin is nice and healthy, right? So
Mhm.
I would say one way to do this really quickly for a lot of kids is to use a barrier cream. Barrier creams are things like Aquaphor or Vas. I like Aquaphor as a Vaseline. It is not the cleanest product. I know this is a holistic program, but what
Mhm.
barrier creams do is they do not moisturize, but they create a barrier on the skin. So the skin underneath that barrier can heal.
Mhm.
There's a natural form of Aquaphor called Waxylene. It doesn't work as well, but it's great because it's a barrier cream. So any barrier cream, I'm a huge fan of Aquaphor. If you use it too much, skin won't be able to produce its own natural oil. So like use it sparingly. But if you're starting to see that skin is starting to break, you can use Aquaphor to kind of close it all up. So that's one thing you can do to allow the skin to heal. So the bacteria that normally naturally live on the skin don't get underneath.
Got it. Mhm.
So there's more. So the second part is when you have healthy microbiome in the gut and on the skin,
Mhm.
the opportunity for a lot of the pathogenic or bad bacteria to invade and to be there is a lot less. So really
Mhm.
focus on healing the microbiome. I would, even for, especially for a 4-month-old where your options are limited because you can't really use all the foods in the world, start a
Yeah.
very healthy probiotic like a smidge sensitive or Claire infant are great. And immediately I would say like do the tiny health test would probably be your best bet because you really want to focus which probiotics are going to restore the microbiome in the gut. If the microbiome in the gut is healthy, it's going to be healthier in the skin. Another option is to use microbiome supportive products on your child's skin. So those are Kiss Goodnight brand makes incredible products. They make like a cleanser, they make a balm that help support a healthy microbiome on the skin. And finally, maybe, you can also help from the outside in restore the microbiome with something called Glad Skin. So there's a baby version that has no oats,
Yeah.
regular Glad Skin. It works really well for a lot of kids. It is not a moisturizer, even though it's like a cream. It's really intended to restore a healthy microbiome on the skin. It's like probiotics for your skin, for your child's skin. So you can try that. It works really well for some kids. It can cause rashes and worse redness. It could be irritating for other kids. If it's irritating, don't use it. Do
Got it.
not use wet wraps for kids who are having skin infections that ooze or recently did, because it could actually lock the infection inside and that could cause a bigger problem. I hope that helps.
Yeah.
Try to kind
Yeah.
of
So not using wet wrap, like my dermatologist told me to do a black tea compress wet
do
wrap
that.
on his
Oh
cheek.
no, I really wouldn't use wet wraps for kids who have skin infections.
Got it. Okay.
Recently, yeah. Well, I
And
mean, yeah, no, I wouldn't. I really, 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 really wouldn't try that because, first of all, you have other options, and second, the risk of worsening that infection is more. Bacteria thrives in closed spaces. Bacteria can further get into the skin when you're like wrapping it up and then not allowing anything to. It's just it could be a breeding ground for making things worse.
got
Wet
it.
wraps work well for dry skin really well, right? For
Mhm.
moisturizing, but not for infected skin.
And is it safe, like you mentioned about Aquaphor, is it safe to put an Aquaphor considering it can become a breeding ground for the bacteria
No, it's not the same. Aquaphor is
Okay.
not going, Aquaphor is still porous, so things will breathe. Aquaphor
Okay.
will not increase the risk of infections. No. Wet wraps can, not always, but can. I think it's the risk that we don't want to take.
Oh, because I have been doing wet wraps on his cheeks like 3 times a day. So maybe that's also increasing the
It's not really
weeping.
a great idea to do wet wraps for kids who have recent skin infections that needed antibiotics for treatment.
Got it. Okay. And then how reliable is the blood test, which test food sensitivity with reflex and environment allergies?
Not for under age 2, it is very unreliable.
It's very unreliable.
Yeah.
Okay.
So sometimes they're done if there's a concern for anaphylaxis, but it's unreliable because the results will change. Like in a normal child, one day you'll do a test and it'll show all of these sensitivities and allergies, and then you do it another day, like a day later, and it's a whole different panel. So that's why it's unreliable, because there's so much changing in the body in terms of response in the first 2 years of life.
So how I can find his like triggers? Like he's drinking pumped milk. So do I need to get myself tested for food allergies or like food sensitivities, because maybe that's going into my baby's body?
I would ask your allergist, because that's very nuanced, and I would always refer to your own doctor for that answer.
Got it.
They'll
Okay.
do the right thing. They might say not worth testing, or they might test. Okay.
Okay. So, and then apart from the gut test, which will tell us what's bacteria is missing or what's bacteria is causing the flare-ups, is there any other test that we can do? Because I'm not sure if some people are saying I'm drinking dairy or I'm taking dairy that's causing the flare-up. Some are saying I'm eating wheat.
If you look at the quick start guide, I always recommend considering cutting out dairy, gluten, and sugar as the first step in
Yeah.
the 4-week process of really conquering eczema. So that if you're breastfeeding, that would mean cutting out dairy, gluten, and sugar that is not honey or fruit in your diet, because dairy, gluten, not forever. We don't want to do this forever, but we want to cut it out just so that things could calm down. Okay, so cut it out of so go back to the digital program and start with it says start here, start there. Okay, don't jump to tests. Initially, it's not always a very helpful way to approach it.
Yeah, I saw the digital program, and I have cut down on gluten, dairy, and sugar as prescribed in the digital program. And I have been not taking these 3 foods for last like 3 weeks, but I have not seen any significant improvement in my baby's health. So I was just wondering like what else I can do. Even I'm not eating any nuts and like.
So probiotics and testing for gut health, I think.
Yeah, I forgot the name of the probiotics, but I gave him probiotics in the afternoon. At night, my baby was really sweaty, and he was like, his cheeks was all red. Do you think it can be a reaction from probiotics?
It could be. Depends on the probiotic. So if that's the case, because Claire has a lot of histamine, but Smidge doesn't, so maybe try that one. And start very slowly, always with any probiotic for everyone. Start with like a small amount of the regular dose, and then work your way up over the course of like a week.
Okay. Thank you so much, doctor.
You're welcome. Who else has questions? Let's see, who has their hand raised? All really good questions. Marie, hello. Hi, or Mary. I'm sorry if I didn't pronounce it properly. It'll be Mary, and then Joy. So
I think Joy had her hand up first, so I'll let her go first.
Oh, sorry, my screen doesn't do
No
it properly. Joy.
Oh, thank you so much. That was so sweet.
Sorry, but
oh, don't be sorry.
Who it is, and forgive me if you've been waiting for a long time.
Oh my word, no.
Who was first?
Yeah, no problem. First, I wanted to say thank you so much. It's been about 2 weeks, and we cut all the things, and my daughter's skin is so much better. And her mood is so much better. Like it's just amazing. I mean, she's like a new kid. She still doesn't want to like try everything. So we're going really slow, but I just wanted to say like, she's more open to it. So I'm just really grateful.
Thank you for
Yeah.
sharing.
Yeah.
Good to
Thank
hear that.
you. So I'm wondering if you could tell me, first of all, where to find like the skin protocol. Like, I'm still confused. What do you put on first and that kind of thing? I'm sure it's in there and I just don't know where it is.
Okay. What is your child like? What's the protocol now? What is your child?
Okay. So the allergist said things used to really like immediately burn or itch. So we tried Glad Skin, burned and itched.
Okay.
The allergist said that she had like micro cuts probably from it just being so dry. So she suggested putting Vaseline on and then putting something over it. Like she said it would soak in through the Vaseline. Does that work? I don't know.
Can you say that last sentence again? Put what first? What do they recommend?
Sure. So she suggested putting Vaseline on first.
Okay.
And then putting like the Glad Skin on. And she said that it should soak in through the Vaseline, but I have no idea if that's true or not.
Not really.
Okay.
So in general, Glad Skin might not be the product for your child.
Sure. Okay.
Okay.
I
So
would
they
know
have-
right away.
Yeah, like I don't
Okay.
think it's worth inflaming things. Just there's options in this
Sure.
world. So
Okay.
I just don't think like a skin that's already so inflamed and so itchy, and then we put
Mhm.
something on that could be helpful, but is so irritating. It's an irritating product, so not everyone can handle it. It's not
Yeah.
worth it. Forget it. Instead, if you're looking, so in general, what you want to do is first put on, is she on a steroid or no?
We were doing a steroid. We've been like just a really low dose one, and we've
So
been off
if-
that for a
yeah.
while.
So the steroid goes first,
Okay.
then some kind of like moisturizer goes next.
Okay.
And the moisturizer that I think would be nice would be something like a balm that is microbiome protective, which I love. Kiss Goodnight balm.
Okay.
Or all their products. And
Okay.
then if you want to, then you put Aquaphor on top or
Okay.
wet reps on top of that. That's usually the usual order.
Okay. And that's something we just do for a certain period of time, or like, do we do that forever? Do you know what I mean?
So we want to be in a place where your child doesn't need steroids, right? We
Right.
want to be in a place where your child doesn't need moisturizers. And we
Okay.
want to be in a place where your child doesn't even need Aquaphor. So not forever. It's like the outside in approach. What will get you there is working on inside out, restoring
Right.
the microbiome. Yeah. So no, you don't do it forever. But I would say follow the instructions of your doctors for the steroids.
Okay.
I'm not able to do that because I'm not your child's doctor. So
Yeah.
no, it's always different, but the goal is not forever.
Okay.
Yeah, and using like these things are great. Aquaphor is amazing. It will work wonderfully. And then if you use it for like 2 weeks, your child's skin won't make its own oils anymore because it has negative feedback cycle. So it's really interesting and often forgotten that skin is the largest organ and it has receptors at the end. And if it feels like it's moisturized enough, because it has this barrier and it has all the moisturizers from the outside, it's not going to make its own natural oils anymore. So I don't think any of these should be used forever. Minimize them, I hope that answered your question. What other questions do you have?
Yeah, that's super helpful. And then, okay, so my naturopath doctor suggested one poop test. I can't think of what they're called. And then I took her to an acupuncturist. She suggested another one. And I know you suggest Tiny Health. Like, it feels like that's doing way too many. Do I
Okay, so I'm a functional medicine doc. It's a good question. There are so many tests out there. It is so overwhelming. And I'll tell you, as a functional medicine doctor that has been working with tests that are beyond conventional medicine for years and years and years, I had my favorite tests that I was trained in. They're like really great. They helped a lot. Different companies make different tests, different providers, naturopaths, functional medicine doctors, integrated doctors, even like not physicians, but like health coaches. They could also be trained in using these functional medicine tests. And this is where the world gets very crazy, because then they also have these tests that are direct to consumer. And so I had my favorites and I was using them and everything was fine and great until Tiny Health came out. And they're like, basically their technology is so much more superior than any other tests that you would like go to a specialist like me and pay like almost $1,000 between the testing and the visit, right? You don't need to do that anymore, because Tiny Health's technology is not only far superior, but it's aimed at children's guts. Children are not little adults, so you can use them for babies and kids and older kids, even adults. It's aimed for kids with eczema. Okay, they have a very huge, giant push for eczema and allergies, and they give you actual real life recommendations based on the results. So he basically blew everything out of the water, and I don't recommend any other functional medicine test. Even when someone comes to me as a functional doctor, like I can't think of anything better for this specific need.
Okay, that is super
Personally,
helpful.
but everyone has their different personal opinions, and I had a different opinion. If you asked me a year ago, I would be like, no direct to consumer test is as good. Things change and they're changing quickly. So the answer that I have today might not be the same as the one tomorrow.
Awesome. Thank you so much. I will let everyone else go. Thanks.
Thanks. Okay, great. Marie, I think you're up next. Or
Hi.
Mary. Is it Mary or
Mary.
Marie?
Mary, yeah.
Hi.
I'm having trouble identifying my son's trigger. He's turning 2 next month. Next month is March, yes. He's turning 2. When he was younger, like certain foods would make him get like his face get flushed. Now it's more so we have an issue with itching. And it's hard. I'm having trouble identifying the trigger foods, because sometimes I would give him like the whole day he's like eating something that he's eaten before, and then we introduce him something new, and then we're not sure if that's a trigger or if it was something he's eaten before. One of the reasons being that we did go see a functional doctor, and we did the hair test for sensitivity, and then something that it doesn't show like that he's allergic or sensitive to, like, and we've given it to him and it seems like he's reacts. So it puts me in a gray area where it's like, is it that or is it not? So I don't know if there's what you would recommend to help identify the triggers for itch.
At this point, I would say go with an allergy test in the conventional realm. Go to an allergist. Yeah. If for that age and you're like not, you did everything you can do to try to figure it out. At this point, you could definitely do conventional testing.
Okay, and then in terms of itch, do you think that for itching, is it within something he's usually has eaten in the last few hours, or because they say allergic reaction, sometimes it goes like a day or two or something before they react, right? And so is that the same for itch, or is itch more immediate?
Itch could be immediate or long term. That's why it's very confusing. It could be both.
Okay.
Very one as much as the other.
Right.
Yeah.
Okay. Yeah, we weren't sure, so it just puts everything in a gray area. So then we don't want to give him food, and everything's limited. We started your program, but we actually started the program where his whole life he actually really hasn't had gluten, dairy, and sugar.
Okay.
And it's still itching. So and it's gotten worse these last few weeks.
Okay, great. But it's not just about removing. Remember, like removing is one little part of it. It's not the answer. And the answer is to work on giving your child the things that heal, and also consider keeping a journal with like a symptom journal, like what your child ate and the symptoms.
Right. Okay. Yeah, we do that, but I don't know why. It's just still not clear to me when I do that. So
Yeah,
it's
I think you've like really done everything you could to try to figure it out, and it might not be immediate allergies. So testing.
Testing. Okay, great.
Yeah.
Do you recommend is there a difference between, or like which one would you recommend, the blood test or the skin prick?
I would allow your allergist to decide based on very specific like history and physical.
I see. Okay.
So they're both great for different things. So I wouldn't be able to say like one is better than the other. They're different,
Right.
and I wouldn't recommend either without like doing like a whole hour visit.
Okay, I see. Okay. Thank you so much, doctor.
Okay, you're welcome.
Bye.
Hi, Kat. Question.
Hi, how are
Hi.
you?
Good. How are you?
Good. Thank you for doing this again.
You're welcome.
So great. I have a question, and you can say, "Oh, that's too specific," and ignore it. That's totally fair.
Shoot.
I was just wondering, we had our little almost 4-year-old. He had some super dry skin, and we did some stuff, and we're working on the diet, and I do think the smidge is actually really helping. So thank you for that. And his skin has gotten so much clearer. We took him to the dermatologist because we were like, we don't want us to turn in him. How do you say it? Impetigo? How do you say that?
Mhm.
Yep, that. We didn't want it to happen again. So we went, and she was like, put hydroglyc. She actually was like, he looks fine. It looks like he has dandruff on his skin. And I was like, oh, okay. And I showed her a picture from the day before, and she was like, oh, but that does look like it. So she said, get hydrocortisone 2.5. Mupirocin and ketoconazole. She gave us like 3 different things, and I was like, that seems like a lot, and I don't really want to do cortisone if we don't have to. And like, and I was like, I feel like we're not in the natural realm here. And she was like, I was like, what about detox baths, anything else? And she goes, just bleach. I was like, I just don't like, I know about all these other detox bath options we have. So I just felt like maybe we didn't find the right dermatologist for us, or and then she was like, oh, you can just keep using that olive oil that's been helping his skin. You don't need any of these things. So I was like, are we supposed to put something on? Is this, I don't want to get to a staph or a bad infection. So do we need to find a new dermatologist? Like, I just felt like we were in and out in 5 minutes, and I just didn't know what to do.
Okay, I don't like that you're not trusting your dermatologist. That's not great.
Yeah,
So,
it didn't feel like a great fit.
yeah. So if you don't trust the conventional dermatologist for their conventional recommendations, then find someone else, right? For sure, because you really want to trust the person you're working with, and there's options. So that's one. 2, in the realm of like regular dermatologists, they don't have any ability to have any dialogue besides how to treat eczema and skin infections, whether they be bacterial or fungal. At the root cause, they could just do life-saving medicine, which is really important. Fluconazole treats fungal infections. Dandruff is a fungal infection, by the way. The mupirocin treats topically on the skin bacterial infections, and hydrocortisone calms inflammation. So she basically gave you anything and hope maybe it'll work. Maybe she saw something that was concerning. Maybe that's the case. But like bleach baths were always highly recommended because they kill all the bacteria on the skin. So they might help, but that's not a solution. Like the problem that got you to where you are is not addressed at all in any of these. So that's not the long-term solution. So I think based on what you sound like when you explained that you were like so confused even more, maybe find someone else and then use this as like a supplement to look at the inside out approach.
Okay, and is there like I know you're in New York, New Jersey, and we are in Seattle. So do you have like a recommendation for how to find someone like you where we are? Because I feel like I've tried like 6 places. Do you have friends?
So I was so sad to say that in all of New York State, including New York City, right, big city, in all of New Jersey and New York State, we have 2 holistic pediatricians, and I'm one of them. So I don't know how to, so there's like 5 people in the whole wide world. I think there's somebody named Dr. Anna Maria Temple that does something similar to me.
Yeah.
Wonderful. She's been doing this for a very long time, and I think she sees patients too. I just don't know exactly where she is. I think like North Carolina or something. And then there's a practice called Parsley Health that does like online stuff. They have a very large, like a really huge, big, giant like category of doctors, but they don't usually do pediatrics for last I checked. They're
Oh, okay.
functional medicine doctors, but I haven't checked in a while.
Okay.
They're great. I use them as my doctor. Like I don't know adult medicine, so I go to one too.
Yeah.
Because adult kids and adults are very different. So
Okay.
yeah, so that's all I could think of. And if you think of anyone else, if you know of someone else, everyone listening, please send it our way because there's just not that
You do trainings for other doctors?
not yet.
Not yet.
Yeah.
I do feel like our naturopath in Seattle is amazing. And a lot of the stuff she told us to get was also recommended by you. I just never understood. It was just like, get these things. And I didn't understand and I felt overwhelmed. Now I understand. So I feel like that was reinforcing that she's great.
Good.
But
That's
that
great.
will be so cool if you train lots of doctors.
Oh, hopefully one day. That
Okay,
would be
well, thank
amazing.
you so
Yeah.
much. This was very
Thank
helpful. I
you.
appreciate it.
Thanks, Kat. Okay, let's see. We had 2 more hands. Christina. Christina, you there? Hey.
Yes. Hi, how are you? So can you hear me?
How's everything going?
Good. I mean, it's been a lot. So I know that since I started with you, it's been like a roller coaster. Like she got better, then worse, and then sick. Well, recently, and the only reason why I actually even ended up like looking into this is because Paola Zamora, which is part of the group too, she had her daughter test for mycotoxins and she found that there was mold in her.
Oh.
So I was like, okay, like I feel like I've done everything. Like I followed your program for so long and she's somewhat like still keeps flaring. So I ended up doing an ERMI test for the house.
Okay.
And it came back positive and for mold. And I was really shocked because I used to get really sick at my old job because it was an old building. And I was like, there's no way this house has mold. But I was like, okay, let me just check and see. And then that came out positive. And then I ended up having people come in from the insurance. They didn't find any mold. And finally, I hired a company. And they found it in the air. In the air vents, the air ducts. So we had it remediated. We had to be out of the house for a day. We got a brand new AC unit, everything. So my question to you, I mean, I did start working with a functional doctor as well because I had to see more like, you know, what to do. But in your practice, I mean, like, I don't know what any recommendations that you have, like, do kids have to like use binders in order to get the mycotoxins out of their body? Is it something that they naturally detox? Like, where should I kind of...
I don't really work with those formula things, to be honest. So if you're looking to do that, yes, binders are always there, like they're an option. My suggestion is make sure that the doctor that works to give recommendations for your child doesn't do aggressive treatments like IV treatments and like hardcore binders, because things can get really crazy out there and it's just not very well like studied for kids. When you pull something out of the system, you can do it very aggressively and very effectively, but it has to go into the bloodstream before you pull it out. So whatever solution your child's doctor recommends, make sure it's just like very holistic and natural and gentle. I wouldn't use the same things available for adults for kids. There's a lot of stuff out there, pulling heavy metals and IV chelation. On and on and on. I don't. It doesn't sit right with me. It's not tested for kids. And kids are not little adults, and it just doesn't work the same way. So.
Okay, good to know. I know one product that was recommended to me, and I think you have recommended in the past, but I just wanted to be sure. It's Ion
Biome. Oh yes, you could definitely do that. Ion Biome, perfect. That's great. You can use it. It's wonderful. Perfect. Okay, I can't say it's a binder. It more like stops glyphosates from affecting your child's life.
Oh, okay.
Great. A lot of it's good. It works. There's a lot of good stuff out there. So yeah.
Okay, so that's pretty much it.
Okay.
alone, you don't do like mycotoxin testing and
Not typically.
okay.
Yeah.
Okay.
Okay.
Um,
Yeah.
You find this to be like a root cause sometimes, like the
Yeah.
mold? Oh,
Yeah,
does.
it can be. Yeah, yeah. So I'm glad you did that. I know you were seeking far and wide. Also, is your child in school? Because schools are the #1 places with mold.
No, she's not. She's not.
All right. Great.
Okay, thank you so much.
You're welcome. You're welcome. Nice to see you. Let's see. We have Kristen, hi.
Hi, thank you. Sorry I had to leave a little bit, but I was able to jump back on. So I do have a question. My daughter did follow up with her dermatologist last week and an allergist, and nothing really came back for allergies. They only did environmental. So I'm not too worried about that. But they did detect some staph on her skin, and so they treated her with oral antibiotics. And everything was looking really, really good for the time that she was on it. And we were trying to, make sure we're still doing probiotics and slowly adding the ferments because I did suspect some histamine intolerance earlier on when she was on a cleanse. But so far it seems like it's going okay. We've been adding it back in, but then just today she woke up very blotchy and red again. And I know, healing's not linear, so I know it can kind of go back and forth. I guess because things were looking better, and then she's still on the antibiotic. She has one more day left. I don't know if it's because we're getting to the end of that, or if the antibiotic helped or calmed things down or did something, and then maybe it's getting started back up again, or if there is a histamine response potentially
It might
happening.
be. Usually antibiotics, they work and then they keep like everything is under control.
Okay.
So it's probably not the end because you're like finishing the antibiotics.
Okay.
It
And
could be
it's
just-
not terrible. I mean, she is and she went through where she was just like so dry, like very scaly, and it was like shedding almost. And so I thought, well, maybe this newer, fresher skin is just a little more sensitive. I don't even know if that's
it could be. The newer skin is usually itchier, that's for sure. So
she has been pretty
yeah.
itchy, even though
So-
she's not as dry. Yeah.
right. So itching is something that usually lingers, heals last. As long as it looks better, then you're on the right path. If it's still
Okay.
itchy, it's like anytime skin is reforming, it's going to be very itchy
Sure.
for a long time, even up to like a few months.
And is it normal to be a little red and blotchy during that period of healing as well?
Could be, yeah.
Okay.
Yeah.
Okay.
I know it's like
One of
non-specific information, but
I know that's okay. And we're just taking it day by day. So that's okay. One other question she actually had was she notices if she sleeps, all night on one side, that side will be
okay.
more irritable when she wakes up.
It could be the heat. Make sure that,
Okay.
yeah, it's most likely the heat. Okay, it could be the detergent. You probably thought about that, right?
Yeah. Yeah. No,
Okay,
I don't
so-
think that's the issue. Mhm.
Okay, it could also be the fabric might be too rough.
Okay.
So that's another issue. And it's most likely though the heat, okay? So keep everything really cool. Make sure that the sheets are like bamboo or very low thread count cotton, because very high thread count doesn't allow breathability.
Okay. Okay. I think that was all of my questions. Yep. Thank you so much.
You're welcome. You are welcome. Great questions, everybody. Let's see, any others? We have some, okay. Oh, Kat asked, how do we get skin tested for staph? So you could actually, it's not usually done in the outpatient like setting, but you can definitely, like in the hospital setting, we're able to do a swab. Maybe a dermatologist could do it. We literally just swab the skin and then send it to a lab, and it'll tell you what bacteria is on it. It's not usually done in the outpatient setting, or it's not like a test that's available for people. So that was the question online, that you can't really test skin for staph, but if there's like an infection, a dermatologist or a doctor can actually do that test. Like if there's an abscess or weeping or oozing, that you could swab easily and send it to a lab. Your regular pediatrician could do it too. Maggie, did you have a question?
Hi, yes, I did have a question. So I feel like I'm always kind of just searching the internet about eczema or listening to podcasts, and I came across one that talked about why something about how you need to open your drainage pathways in order to heal, and something about drainage. And I was thinking, well, that's something I've never heard of, and how do I go that route? Because I feel like I try everything. So I was just wondering, do you know more about that?
Yeah, so I bet you it was a podcast for adults.
It was just eczema in general, but I'm not sure.
Yeah, so sprinkled throughout this program are the ways to support the liver, and mostly it's like for adult medicine. So like really the problem with drainage pathways is adult medicine stuff. So what they recommend is things like dry brushing to open up the lymphatic system, going to a sauna that opens up the drainage pathways, to like sweat out all the toxins, making sure that the liver is fully supported. So sprinkled through this whole program are supplements and teas that I recommend. But the best way for a child to open up their drainage pathways, especially when it relates to eczema and the causes and the root causes of eczema, is that the gut is the biggest drainage pathway. Okay, so that's like the number one way to make sure that your child is opening their drainage, that they're pooping well, that they're absorbing all the nutrients that are antioxidants that help calm all the inflammation, that they're pooping really, really well, that they're able to eliminate through their gut all the things that they don't need in their system. And it's why we focus so much on gut health, and all those roads lead to gut health. So I know it sounds great, like I've sat down and I have charts that I wanted to add, but none of this really applies for kids. What it means is have your kid run around, because that opens up the drainage pathways. For adults, it might mean like jump on a trampoline. That also opens up a drainage pathways. But for kids, it's really just making sure that they're active, they get sun exposure, and like things like dandelion root tea is great, liver support.
Okay.
Ooh.
All right.
Yeah.
Thank you.
You're welcome. Okay, I'm gonna take one more question because I have we're running out of time, and any other questions today?
Can I go if nobody else is asking?
I
Or
don't see anyone else. Yes, please go.
yeah, is it okay to give cod liver oil to
Yes.
to my kid having eczema?
Yes, I like cod liver oil. Make sure it's a really good one. Rosita is one of my favorite brands.
Yeah, I think that's what we are getting. Yeah.
Okay.
And can I go one more question? Sorry.
Yeah.
Okay, so what should be the screen regimen for every day? Like after taking bath, the skin where we have eczema, what should we put, like various creams, lotion, moisturizer, versus where there is no eczema, what should we do? Like how do you have any recommendation? Like how should we go with that? If I'm not using steroid, just the regular thing, I'm trying to manage the eczema, then
I would say just minimum, less is more. So using like a very non-toxic moisturizer is really just like the best place to start after a bath. So I would say, you know what, you don't even have to use soap in most cases. If you do use one that is very microbiome protective, like Kiss Kiss Goodnight, Lullaby cleanser is just very gentle. You don't have to use a lot of soaps. Don't use abrasive soaps, antibacterial soaps, harsh soaps, chemical soaps, scents. Avoid any essential oils as well on kids who have eczema. Make sure that skin is dry, and like immediately after you can apply moisturizer. I really love tallow as a moisturizer. Not anything special. Read the ingredients. One of my favorite is just literally the tallow that you use for cooking that's organic and so like for example, Fatworks is a really great one, or you can use a moisturizer like a balm from Kiss Kiss Goodnight. There's a whole list of moisturizers that I do like. You have options. Another one is neem oil, which is really great. You don't have to mix it with anything. You can apply it. Different kids respond differently to different moisturizers because they have different genetics and microbiome. So if one doesn't work, try a different one. There's a whole list inside the digital program of moisturizers that I do recommend.
Okay, so first moisturizer, and then for the patches where I have eczema, I can put those barrier creams like Aquaphor or Vaseline.
Yes, especially for bed.
Okay, all right, that's okay.
All right, great. I just want to make sure I answered everything in the chat box before we go. Yeah, I think question was, do you use tallow everywhere? You can use tallow everywhere, but it can stain clothing, so be careful. Let's see. Joy asked, if you have time, do you suggest adding one thing at a time? Yes, go slowly. Great question. Always go one thing at a time. Don't add all the supplements together at the same time. Don't add new foods at the same time. Go very, very, very slowly. Like take your time. Time flies, so you don't have to rush through this. The 30-day Conquer Eczema program is like, it's divided into 30 days or 4 weeks, but you don't need to go that fast if you don't feel like that's great for your child and your family. And final last question in the chat box is it safe to use a pathogen killer? Natural Path gave us a supplement. I don't know what they gave you. I don't know if it's safe. So it's really hard for me to answer that question. Some are very safe, some are not that great. So I think that just make sure that the person that's recommending that for your child is well-versed in pediatrics, because kids are not little adults. So that will conclude today's incredible session. I am so very, very thankful for all of you for being here for a whole hour and a half. Thank you so much for your amazing questions and for being here and for being empowered parents and for being there for each other inside the Facebook group. I am so grateful to share this knowledge with you that I just love to share and spend a lot of time collecting and sharing and continue to always learn. And I hope you do as well. So thank you so much, everybody. If you want to pop into the Eczema Rescue Club, I am doing another live session. It's about 30 minutes long about parenting, empowered parenting, empowerment. It's going to be lots of fun. And so that's not a Zoom call, it's a Facebook Live. And I hope to see you inside. And if you want to catch it later, you could catch it later. Plus there's a giveaway. So thank you so much, everybody. I will be posting March schedule in a couple of days. And if you have questions between lives, please ask it in the group. As you see, I answer them almost every day. So thank you. Have a great day, everyone. Bye.